Graves. This is my advanced assessment video head-to-toe assessment for Maryville University. This is my friend and coworker Marcia, who has graciously agreed to be my patient for this exam. So prior to coming in here, we have done her vital signs, including height and weight. I've asked her to empty her bladder, and I offered her a gown, but she opted to stay in her t-shirt and shorts, which is perfectly fine for me to do this examination. So if I didn't know Marcia, I would come in, I would wash my hands while I'm talking to her, introduce myself, and we've already done the history portion of this exam. So I'm going to start with just evaluating your head, making sure that it's round, it's symmetrical, ask you if you have any problems there.
Should I leave my glasses on?
Not right now, that's fine. So I'm going to start by palpating your skull. I'm going to feel for any masses, bumps, lesions, any points of tenderness. While I'm doing this, I can obviously feel your hair, find any places of hair loss, alopecia, make sure your hair is smooth, it's not coarse, you look well kept, you're clean, you've obviously showered today, so everything there looks exactly fine. I will have you remove your glasses for this portion. I'm going to palpate your face. Your face is symmetrical, your eyes are symmetrical, your nose is evenly lined, your mouth is symmetrical, there's no drooping. And I'm just going to lightly palpate your face. Tell me if there's anything that feels tender, sore while I do this. I don't feel any deformities. I'm going to palpate while I'm here. I'm going to palpate your frontal sinus, your maxillary sinus. And I'm going to check your TMJ if you would just open your mouth. I don't feel any clicking or cracking. Do you have any problems there?
No.
Okay. So we'll move on to your eyes. Your eyebrows are symmetrical and they're full. I'm looking at her eyes in general. Her sclera is clear. I'm going to check her conjunctiva. It's nice and pink in both eyes. There's no swelling around her eyes. I'm going to lightly palpate her eyelids and her lacrimal apparatus. No tenderness there, no nodes noted. So for this part, I'll be shining a bright light in your eyes. I'm checking for pupillary response. We'll do a direct and indirect, direct, indirect, and then we'll check your cardinal signs of gaze. If you'll just stare at my nose, not move your head at all, but I'm going to have you follow my pin light with your eyes. We're checking cranial nerve 3, 5, and 6 for this. So you can either do an H pattern like this or a star pattern. I choose to use the star pattern. So we'll start in the center, just follow with your eyes. If you notice a little bit of nystagmus, that's normal variant, and I don't see that for her. Next, I'm going to have you cover one eye while looking at the other eye, and as she uncovers this eye, I will check to see if there's any extraocular movements or nystagmus, and I don't see that, and we'll do it for the other eye. You can uncover, and that's fine. There's no extraocular movements. I will say that we checked her near vision and her distance with the Snelling chart and the Romberg chart used for near vision prior to coming into the exam room. Marcia, if you would, I'm going to have you cover one eye with this, and I'm going to cover the same eye or eye on the same side for you, and I want you to tell me when my fingers come into view for you.
Here. Kind of silent.
Good. Good. And we'll cover the other eye.
I can kind of see him all the time.
Oh, really? I like to do it like this.
Yeah.
Yeah, good.
Here.
Good. Let's try the other eye.
Here. Here.
Good.
Here.
Good. All right, you can put your glasses back on if you like. I have you close your eyes. I'm going to check for light sensitivity. I want to make sure when I touch your face with this Q-tip that it's equal on both sides. Touch there, there, is that equal?
Yes.
And on your cheeks, is that equal?
Yes.
And your chin, is that equal?
Yes.
Good. We will move on to examining the ears. I'm looking at her ears. They are equal on her face. They line up with her eyes appropriately. I feel her auricles. There's no masses, there's no tenderness noted. There's no drainage from either ear. I'm just gonna be looking in your ears. Ear canal should be clear, not red. Her eardrums are pearly gray. Everything looks normal, and I did pull up on the auricle, not down. Down would be for pediatric patient. Marcia, if you'll turn towards the window there, cover one ear. I'm gonna whisper a word, and I want you to tell me what I say.
Apple.
Good, if you'll cover your other ear.
Rainbow.
Very good, and that's a hearing test for her. We'll also do a Weber and Rhine hearing test. Weber test, we will use this for our in lieu of a tuning fork, and we will put it to the top of your skull like this. I want you to tell me when you don't hear it anymore, or if you hear it equally on both sides. You hear it the same on the right and the left?
Yes.
Thank you. Next, we'll move on to bone conduction, air versus air conduction. I'm gonna touch this to your mastoid process, and I want you to tell me when you don't hear it anymore, and then I will put it in front of your ear, and you tell me when you don't hear it anymore. Mastoid process. Just tell me when you don't hear it anymore. I don't hear it. And then in front of her ear. And air conduction should be 2 times longer than bone conduction. Obviously, I would do it bilaterally. Okay, we'll be moving on to assessment of your mouth. I look at your lips. They're full, they're pink, I don't see any cracking, no fissures, and I note that also at the corners of your mouth. I'll look at her teeth, if you'll open up your mouth. Teeth look good, they're clean, they're in line. I can see the floor of her mouth now with her tongue lifted up. And if you will stick your tongue and move, I can look at the lateral sides of her tongue, I don't note any areas of discoloration or sores. I'll look at the hard palate and the soft palate, and I see no problems there. If you'll swallow, good. And I saw the uvula move upward, testing the hypoglossal cranial nerve, and that's all normal. Now I'm going to test cranial nerves, and then I'm going to have you do a few movements, and we'll just test them to make sure they're all normal. So I want you to smile, show me your teeth, stick out your tongue, and lift your eyebrows. Clench your eyes and shrug your shoulders. Good. I'm also going to check range of motion of your neck, so we'll start right there with range of motion. I want you to touch your ears to your shoulders, chin down, chin up, and we'll do the same thing, but I'm going to apply a little pressure. Chin or head to your shoulders. Good. Head to your shoulder. Good. Chin down, chin back, and shrug her shoulders. Very good. Also assessing her neck, it's full. I don't see any JVD. Her trachea is midline. I see no problems here. In looking at lymph nodes, I'll check preauricular, postauricular, occipital, tonsillar, submental, submandibular, post-auricular chain, or post-cervical chain, pre-cervical chain, post-cervical chain, deep cervical, and supraclavicular and infraclavicular, as well as axillary. I felt no hard nodes, no movable nodes, and I did not elicit any tenderness there. I'm going to just listen to your carotid artery. Use the bellow of my stethoscope. If I can get you to turn your head, please. And turn it towards me. Listen on your thyroid. I'm just going to feel your thyroid, and I want you to swallow. Very good. And that is all normal. Marcia, if I could just have you extend your arms, I'm going to examine your upper extremities. I'm making sure the temperature is normal, that she has good muscle tone. I check her fingernails. She's got brisk capillary refill, less than 2 to 3 seconds. I'll assess radial pulses, making sure the amplitude and intensity is equal. Same for the brachial pulses, and that is all equal. And I'll assess for strength here as well. If you could put your arms out in front of you again, I'm going to have you press down, press up, press down, press up, and out to the side. Again, press down and press up. Great. At this point, if you could turn around for me, I'm going to assess your back. Again, we start with inspection. We'll just inspect the back, the skin for uniform color, any deformities, and here I see none. We'll go on to percussing the back in a systematic fashion. Do it in the intercostal spaces, and you're listening for resonance. And then we'll go to the sides. Now I'm going to measure for diaphragmatic excursion. Actually, first I'll measure for symmetry with inhalation and exhalation. I'm going to put both hands around her, have her take a deep breath. My hands should move equally as they did. Now I'll measure for diaphragmatic excursion. Marcia, I'm just going to lift your shirt just a tiny bit. If I could have you measure or lean forward a tiny bit, and I want you to take a deep breath. And right here, I would mark this place. We can mark it with a pen. We can hold it with a finger. And then we will start from the bottom. I want you to take a few deep breaths, and then I want you to exhale and hold it. Again, we would mark that spot and measure. It should be between 3 and 5 centimeters, which is normal. We would do the same for the other side. Next, I'll move on to, I'll percuss the costovertebral angle indirectly. And this should not elicit any pain. We'll listen for breath sounds. Again, we'll do it laterally. Breath sounds are equal bilaterally. both posteriorly and in the axillary area. Okay, Marcia, thank you. I'm going to have you turn around. Again, we start with the anterior chest and looking at the chest wall, making sure the skin is pink and warm, that our chest is symmetrical. You're looking for, I'm sorry, I forgot one thing on your back. If you'll turn back around, I apologize. Sorry. Yeah. We're going to test for tactile phremesis, and I want you to say 99.
99, 99, 99, 99.
Thank you. And you can turn around. And one other thing I forgot, and I'm sorry, we're going to test a gag reflex. So I'm moving back up to the mouth, and I apologize. Open your mouth. And she has a normal gag reflex. So now we are moving back to the chest, anterior chest. Again, we look for symmetry. There's no heaves. There's respiratory rate is normal. It's symmetrical. I am going to listen for breath sounds anteriorly. And that would conclude assessment of the lungs. We'll palpate the chest now. 99,
99,
99,
99,
99,
99.
and I'm going to percuss the chest. Sorry. That's great. Now I'm going to listen to heart sounds. Listen in the aortic area, pulmonic area, Erb's point, tricuspid, and mitral. I'll check for apical, point of maximum impulse. And I'll check her chest here, palpating, and here. Okay. Marcia, if I could have you lay down now, we're going to assess your abdomen. There's going to be several things I do here. If there's anything that I do that causes any tenderness or pain, I want you to tell me. Yeah, it's fine. First, I'm going to look at her abdomen horizontally. I'm going to make sure that there's no, that her abdomen is shaped uniformly. There's no pulses, no abnormal movements in her abdomen. It all looks good. In auscultating her abdomen, I'm going to start in the left lower quadrant. Systematically listen to all quadrants. Listening for abnormal vowel sounds. If none were heard, then I would listen up between 3 and 5 minutes for any vowel sounds. Thank you. I'll percuss her abdomen at this point. And I will do a palpation on your abdomen. First, it's just going to be just kind of a general light palpation. And then a deeper palpation. With this, I'm looking for any masses, nodules, any areas of tenderness that she might have. I can palpate her aorta. then I will palpate the borders of her liver, or percuss for the borders of her liver, starting in the area of tympani and moving upward in the midclavicular line. So we would mark right here, and then starting upward in the midclavicular line, change, look for change in the sound. Measure these areas, it should be between 6 and 12 centimeters. Now I'm gonna palpate your liver and also your spleen. You're fine, I'm sorry, I keep bugging at it, that's good.
This might be easier if I loosen it.
Thank you. Thank you. I might want to come over here. So, with one hand underneath, I'm gonna go under here, trying to feel the edges of your liver. And then I'll go try to feel the edges of your spleen. You should not be able to feel those lifting up. You can also percuss for the liver. If you were to hear anything but tympani, yeah, the spleen, anything but tympani, then you would go laterally and have her take a deep breath. Again, if you heard something other than tympani, then you would want to assess for enlarged liver. You should not normally feel that. I'm going to have you turn on your right side. Again, I'm going to palpate and percuss for the liver. I'm also, your spleen, sorry. I'm also, at this point, going to have you turn again, and I'm sorry I'm having you turn everywhere, but it's easier to turn when you're laying down. Yes. And I'm going to listen to heart sounds while you're laying on your side. Thank you. Now you can turn back over on your back. While I have my stethoscope, I'm going to listen to her aorta. Her right and left renal artery. The left and right iliac arteries, as well as the femoral arteries. I'm going to try to palpate for your kidneys, I'm sorry. Okay, thank you. So I'm going to move on to your lower extremities. Again, like your upper extremities, we're looking for muscle tone, normal muscle mass, skin tone, pink, warm, dry. We will assess popliteal arteries, making sure they're equal bilateral with normal and equal amplitude and intensity. We'll assess posterior tibial and pedal pulses. Again, I'll look at capillary refill, should be less than 3 seconds. Marcia, I'm going to, while you're laying down, one other thing on your abdomen, I want you to slightly raise your head. I'm going to check for muscle tone in your belly. That's great, thank you. I help you to sit up, turn around for me. With your legs, I want you to try to push back, push forward, push back, push forward, and I will check your reflexes at this point. Just relax your medial, radial. Your knees. Posterior tibial, and your kidneys. Okay, last thing, well, two things. I'm gonna check for sharp and dull sensations. So this is what it would feel like sharp, and this is dull. Okay, so if you'll close your eyes. Sharp, dull, sharp, dull, 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 sharp, sharp, good. Sharp, sharp, dull, dull, sharp. Thank you. And last but not least, we'll look at your back. So let me help you get down here. I'm gonna have you just stand normally. I'm sorry, short, sir. I'm gonna assess her spine, palpate her cervical spine, thoracic spine, and her lumbar spine. And if you'll just bend over ever so slightly, I'm looking for scoliosis, kyphosis, and I see none there. So this will conclude our examination. Thank you. Thanks, Marcia.